Hi there, this is Dr. Scott Mosser, and I am a gender surgeon in San Francisco, California. I created this video to demonstrate how an FTM double incision surgery is performed and to clarify some things that, even with a live surgery video, might remain a bit confusing. The double incision surgery remains our most powerful tool for chest masculinization. The surgery allows us to obtain the tightest, flattest result and to completely customize the location of the nipple on the chest, but it does come with the trade-off of a considerable scar on either side of the chest and also a decrease in nipple sensation from possibly being hypersensitive to having more of a normal chest skin level of sensation. This surgery is most suitable for patients that have a degree of excess skin in the chest with some overhang of the chest tissue. This is what I would call an infra-breast angle of less than 90 degrees. And this surgery is most useful when the patients simply want the flattest, tightest result which is possible. This link will take you to a page where you can learn a little bit more about the different surgery options related to individual body types. The double incision surgery is, in a way, started before even the operating room procedure, meaning that chest markings are placed on the patient before anesthesia, and these are important to the execution of the surgery. These markings allow the surgeon to make an initial determination of incision placement and also trajectory, and to understand how the chest contour appears when the patient is in the upright standing position. Once the patient is under anesthesia, the markings are double-checked, and the areolas are marked with a 22 millimeter areola sizer, which is the average diameter of a cis male areola. These areolas are then removed and stored temporarily to be later grafted onto the same sides of the chest once the skin has been tightened. Sometimes liposuction is performed in the upper chest and the outer chest areas, and if necessary, it's performed at this step. Then the incisions are made, and care is taken to remove as much of the breast tissue as possible while providing a smooth and even contour of thickness of the fat beneath the skin and extending into the upper, outer, and the surrounding chest areas. This is a component of surgery which is very important to get a smooth and even result and really requires a lot of attention to detail on the part of the surgeon. Then the skin edges are lined up meticulously to provide a smooth final result, and the skin edges are sutured closed with dissolving stitches that cannot be seen from the outside. At this point, the optimal location for the nipple and areola is determined based on the body's particular characteristics and also the shape and orientation of the underlying muscles. This is a procedure where some science and some artistic intuition on the part of the surgeon will come to play. Once the optimal location of the nipple and the areola is determined, the skin is marked here once again with the 22 millimeter areola sizer, and the outermost skin is removed. The nipple grafts, which have been thinned and prepared for grafting, are then placed over these regions and secured in place with the stitches that will ultimately hold the outer bolster dressing in place. The additional sutures are placed outside the skin graft to secure it in place, and then the bolster dressing is applied. These funky-looking bolster dressings are necessary to hold the skin graft into place for the critical first few days of skin graft take after surgery. Most of my patients do not receive drains for a double incision procedure. When they are placed exiting through the outermost portion of the incision so that they're not painful and they do not cause additional scarring. Some options in this procedure include joining the incision centrally if there is a lot of excess skin right in that region, which can help prevent any pleating or ruffling of the skin and instead have a flat, smooth contour if that is necessary. Additionally, excess skin and fat in the outer chest might be able to be removed by extending the incisions laterally if necessary. There are some patients that have a considerable amount of excess skin or breast tissue in the outer chest, which can put them at a higher risk for having a bulge in that area after surgery, which is commonly called a dog ear. I'm going to try to produce a dedicated video to explaining what dog ears are all about and how they are either avoided or treated if they occur, so stay tuned. So that's about it. Hopefully this has helped to explain a bit about what the time-honored double incision procedure is all about. It does have its trade-offs, but in many ways, it's still the most powerful tool that we have for many body types for chest masculinization surgery. For more information or to schedule a virtual consultation, click on the link, and to look at more videos in this collection, please click on the box in the upper right-hand corner. Thanks and have a great day.